I'm honored to be a part of this. This is just an amazing, pivotal, landmark, milestone event. We're talking about long overdue, and it took the expertise of Ty and Charlene Bollinger and their incredible team to bring it to the public and to bring in such a huge audience and people live online. So it's an honor to be a part of it. I'm just part of it, and I'm seeing well organized, a great deal of enthusiasm. I've already talked to physicians who have come from around the world for this conference. I'm impressed. I am just very pleased. I'm heartened by the fact that the audience is receptive, supportive, warm, enthusiastic. Essentially, I guess we're sort of preaching to the choir in the sense that the people who are here already embrace the philosophies of nutrition, meditation, exercise, kinder, gentler, more rational, more subdued therapies for cancer and other diseases. So these people already embrace them, and now we're saying, and here's reasons. And here's an expert who has used this in clinics and has peer-reviewed evidence to support it, and they're saying, finally, I'm not a voice alone in the wilderness. So these voices alone are coming together as a giant choir. I think what happens is they talk about the 99th monkey. Actually, in biochemistry, they talk about the microbiome, and what we have is roughly 100 trillion cells in our gut that are commensal organisms. They're eating at the table with us. They take leftovers from what we eat, and they're greatly changing our immune system, our disease resistance, and so that commensal organisms, what they talk about is quorum sensing. Quorum means a majority. So if you have 100 trillion cells and let's say that 51% of them are in favor of good health, you're in good shape. If it goes to 49% are in favor and 51% are deleterious or dysbiosis, now you got a problem. And what this group is doing is we're pushing it over the edge. We're getting into quorum sensing, that the population, we're going to reach critical mass very soon, which of course is a phrase that comes from nuclear energy, and they talk about how do you detonate an atom bomb when you hit critical mass, and we're there. My talk was on beating cancer with nutrition, and essentially what I say is that nutrition is essential for all cancer patients, but it is not sufficient. Meaning I would not use nutrition as sole therapy for cancer, but it should be part of all comprehensive cancer treatment. And basically, Americans and people in developed countries are eating a wretched diet, and it's fertilizer for cancer. And if you use good nutrition, you can upregulate your body's own host defense mechanisms to find and destroy the cancer, to lower cancer growth, carcinostatic, which augments anything else that you're doing. If you don't want to end up in a cancer hospital, do this. If you're in a cancer hospital and you're using any other therapy, do this. There are times when, as an author of nutrition books, someone can become a little disenchanted and feel like perhaps being ignored or neglected. And so in my 35-year career, I have had highs and lows, and this is definitely a high point. It's saying that time is now, that there is a recognition of the public, more medical professionals, the scientific evidence is there. When we get government insurance people on board, and actually the real change is going to be when it's proven to be the most practical approach to healthcare. So right now, cancer treatment costs maybe $250,000 for your average patient. What if you use nutrition and these other therapies and it was only $25,000? You just saved $225,000 and probably improved the quality and quantity of life for the cancer patient. I'd like to say that you can empower yourself. Too many people sit back thinking that the diseases, cancer in specific, is the boogeyman hiding underneath your bed and there's nothing you can do about it. It gets you or you don't, and there's nothing you can do about it. Not true. My message is one of empowerment, that what you eat or don't eat plays a huge role in your general health, and you can dramatically lower your risk for getting cancer, and if you get cancer, you can improve your odds of beating it. This is about empowerment, knowledge, and action. My name's Patrick Quillin, and I'm proud to be a part of this, and I hope you will join us in this movement.